Today's medical-centric topic is Pharmacogenomics in Psychiatry, Personalizing Antidepressants. Why antidepressant prescribing is still trial and error. Choosing the right antidepressant often involves weeks to months of trial and error. Many patients experience poor response or intolerable side effects before finding a suitable medication. This variability has driven interest in pharmacogenomics as a way to personalize treatment. What pharmacogenomics actually means. Pharmacogenomics studies how genetic differences affect drug metabolism, efficacy, and side effects. In psychiatry, it focuses mainly on genes involved in drug metabolism enzymes, transporters, and receptors that influence how antidepressants are processed in the body. Key genes that matter in antidepressant use. The most clinically relevant genes are CYP2D6 and CYP2C19, liver enzymes responsible for metabolizing many antidepressants. Variants in these genes classify individuals as poor, intermediate, normal, or ultra-rapid metabolizers, which affects drug levels in the bloodstream. How genetic differences affect treatment. Poor metabolizers may experience higher drug levels, leading to side effects even at low doses. Ultra-rapid metabolizers may clear drugs too quickly, resulting in poor response despite adequate dosing. Pharmacogenomic testing helps predict these patterns before treatment starts. What pharmacogenomics testing can help with. Testing can guide dose selection, identify medications likely to cause side effects, and flag drugs that may be ineffective due to rapid metabolism. This is especially useful in patients with multiple treatment failures or significant adverse effects. What it cannot predict. Pharmacogenomics does not predict whether a drug will work psychologically. Response to antidepressants also depends on brain chemistry, severity of illness, psychosocial factors, adherence, and comorbid conditions. Genetics explains only part of the picture. Evidence and clinical guidelines. Professional guidelines support pharmacogenomic testing as a decision support tool, not a standalone solution. Evidence shows it can reduce side effects and shorten time to effective treatment, but it does not eliminate the need for careful clinical follow-up. Who benefits most from testing? Testing is most useful for patients with treatment-resistant depression, unusual side effects, polypharmacy, or a history of poor tolerance to medications. Routine testing for all patients is not yet recommended. Cost and practical considerations. Tests are increasingly accessible but vary in cost and insurance coverage. Results are usually lifelong and can inform future prescribing beyond psychiatry. Risk of overinterpretation. One common pitfall is assuming test results dictate the best antidepressant. In reality, they indicate which drugs to use cautiously or dose differently, not which will guarantee success. Clinical takeaway. Pharmacogenomics helps personalize antidepressant prescribing by reducing guesswork around dosing and side effects. It is a powerful supportive tool, not a replacement for clinical judgment. The best outcomes still come from combining genetic insight with careful monitoring and patient-centered care.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.